Well, I'd like to start by saying it's quite an honor to speak at this meeting. I've met a few physicians over the last day or so, and progressive, think out of the box people. We all have to learn what we didn't learn in our medical training, and it takes courage to change your paradigm of thinking. Let's see what we got. Is this good to go? So anyway, just to move things along, what am I using here? This one or this one? That's okay. Let's see. This is the one they've been using. There's another one. If I get near a computer, beyond reading research, I will break it. So don't know. Hey, Ian. I shouldn't have broken it already. I didn't touch it, you know. It's the electromagnetic field. There we go. Which one? No, forward and backwards. Yeah, okay. It was just, okay, environmental toxins and their impact on brain chemistry in the industrialized world. It's not just Americans. 25% of my patients are out of country. And turn it up. Don't know if I have control over that. Okay. Is that better? All right. Sorry about that, guys. No, I have no relationships with anyone. All I do is treat patients. Mental health epidemic. Is it genetic or epigenetics? I'll tell you, I love genetic testing. But when you realize that every therapeutic maneuver you perform, we have a 50-seat IV room, it is easier to do good clinical research. And I say, as I walk around the room, every therapeutic maneuver is a diagnostic maneuver. If you read and understand the underlying physiology and biochemistry, the patients are the best teachers. And so we've actually performed over 11,000 neurotransmitter tests, began in 2006, began referring patients for SPECT brain imaging to Daniel Amen in 2004. In July 2006, I began measuring neurotransmitter levels and correlating those to SPECT scans and aberrations on SPECT scans and symptoms. And we determined a lot of fascinating information. Then we correlated mold mycotoxin levels and industrial toxin levels to changes in brain chemistry patterns. And it just goes on. I started, of course, with gut toxicity. If you came to me in 2005 as a patient, I would have told you that the gut toxicity is everything. And it is everything, and it's the least of everything. The big deal, really, is the mold toxin genetics. In 1973, we had an oil embargo, and it scared us to death in the Western world. Europe, Canada, America. And we made airtight, energy-efficient gas chambers. So the homes and office buildings that once breathed were suddenly made with the good intent to save the environment, made such that they don't breathe. In anyone with a basement, you most likely have black mold behind the basement walls. If nothing else will get you, even my Scottsdale, Arizona patients will have mold toxicity from black mold behind the shower tile. It may be 10% humidity in the front yard, a cactus in the front yard, but if you look at the shower tile, and you should all do this when you go home, get with a flashlight on your knees and look at the grout. You should regrout every 3 months. If nothing else takes you down, the shower tile will get you. The hidden black mold is a stealth menace to our health because the black molds do not smell. And having performed 6,000 mycotoxin tests and correlated those mycotoxin levels to changes in brain chemistry patterns, to suppression of the CD4, CD8 ratio, the kill ratio, to over 400 and some numerical biomarkers, I can tell you the trichothecene gas produced by black molds is the biggest deal to hit since the Black Plague. By 1980, most homes were airtight, energy efficient, and so we see this incredible surge of various mental disorders. And addiction simply follows depression and anxiety. Patients are either, as I was telling Daniel Amen years ago, they're either medicating and calming overactive brain regions with their medication, or they're stimulating underactive brain regions they inherit. And it was easy to ascertain the inherited underactive brain regions because you have people with an overactive COMT enzyme, the enzyme that metabolizes dopamine in the synapse, will have underactivity in the prefrontal cortex. Why just the prefrontal cortex and not the rest of the brain? Because from the posterior to the PFC, the dopamine transporters control the deactivation of dopamine. But in the PFC, there are very few dopamine transporters, so the overactive COMT enzyme, where you metabolize 4 times faster or 6 times faster than the slowest metabolizers, will cause underactivity of the D1 dopamine receptor above the right eye, focus, brakes, judgment, impulse control, medial frontal lobe, 4-second learning processing memory, the shortest of short-term memories, runs on dopamine. We've had all these changes. How do you get bipolar? I said years ago, good Lord, if bipolar were genetic, patients would be bipolar at age 5, at age 10, age 20. And why was the median age of onset of bipolar 31? It's now down in the 20s. Our clinical research has proven that trichothecene will block dopamine from the brain receptors, and I'll cover this in some slides later. So therefore, it will shut down any brain region that runs on dopamine, including the motor regions, of which there are 3 within the basal ganglia. Yet, we've proven that through precise testing before and after detoxification, intravenous detoxification, that the glutamic acid decarboxylase enzyme, that is the enzyme that converts electrifying glutamate to calming GABA, when trichothecene attaches to it, it downregulates. And we see an upshift in glutamate, downshift in GABA. And this, my friends, is causing the majority of bipolar in America. I referred patients to Daniel Amen's clinic from 2004 and up to a certain point until I did had enough patient volume. We now have PET scans for the same price, a $13,000 PET scan I'm getting for $1,000. Some NFL players helped me negotiate that. So we have a 2,000 patient database on PET scans, and we'll show you some of those in a moment. But the big deal that you should take home, if nothing else from this conference, is that the #1 cause of death in American kids aged 15 to age 24 is no longer motor vehicle accidents. It's actually physicians prescribing dopamine-blocking bipolar medications. And from 2006 to 2007, I had measured and analyzed enough brain chemistry patterns in bipolar-ish people to ascertain that they, being those who treat without any measurement of brain chemistry, have assumed worldwide, not just in America, that most bipolar is a dopamine excess issue. It turns out that about 10 out of 1,000 bipolar patients will have excessive dopamine levels. It is a glutamate GABA shift. It's excito-neurotoxicity. And so if you use a drug, and that's what's so important about this meeting, you folks have to get the word out there. Look, if you don't look, you don't know. If you don't test, you don't know. So if the dopamine level is normal, and your pleasure center, your nucleus accumbens, the electrical current in the nucleus accumbens is derived from dopamine activating the dopamine D2 receptor versus the dopamine D1 receptor above the right eye for focus, braking, etc. If you have underactive D2 activity, so suboptimal, and you block the dopamine which is normal and often even subnormal. I like a dopamine level of around 180 for an optimal 4-second memory, optimal activation of the reward, pleasure, hunger, sex drive center. If you block the dopamine from that D2 receptor, you're going to cause severe depression and suicidality, okay? And that's what's happening. And I've treated thousands of these kids. And yes, you'll turn down the voltage, the electrical voltage globally in the brain, but you will shut down the reward center. And you folks have noticed how many patients, once placed on a drug like Zyprexa, and whatever the new flavor of dopamine antagonist, they lose their personality. They become drones because the frontal lobe shuts down and the nucleus accumbens shuts down. And those who are more compromised than others will actually fall into a suicidal depression. It's a black hole, they describe it, they look out of, they can't crawl out of it. It is different from the depression, which is derived from an overactive deep limbic system. And I wrote a chapter for one of Suzanne's friends in 2010. We have copies of those chapters at our booth. Come to my booth afterwards, describing the difference in the, quote, melancholic depression and what psychiatrists call atypical depression. Atypical depression is not atypical. Knee-jerk reflex is the assumption that all depression is derived from low serotonin. It is not. 50% of the patients I've treated for depression, and it's now over 11,000, their depression was derived from an underactive reward center. There's an ABC story I did in 2010 explaining why children, because that's what the producer wanted, but it's adults as well, become suicidal and placed on an SSRI, a serotonergic medication. Because the more serotonin in the synapse, the more it inhibits the release of dopamine. And that's another issue. Today in America, 10, 20 people, who knows how many, exact number, will kill themselves. Kill themselves because they're placed on a serotonergic drug, and the serotonin is boosted in the synapse without protecting dopamine. And there's an inverse relationship. It's very important. You'll see these patients. More importantly, why would you use a drug that simply blocks the serotonin from being recycled into the vesicles, the storage units? And when I was the #1 Lexapro prescribing doctor in Tampa Bay before I became integrative, we could never get a serotonin much above 175, 200. Research I performed was SPECT-scanned, overactive cingulate gyrus, overactive deep limbic system, depression, anxiety, OCD. It took at least a 600 serotonin level in the average American to calm those two brain regions. If you're female, you have to have an estradiol of 60 to 80 pgs per ml for enhancement of serotonin receptivity.
How about
Men, we don't have that issue. We're simple brains. All brains start out as a female brain. If you have male chromosomes on day 56, you ladies will love this, but that's our excuse, okay? Day 56, a testosterone surge will kill half the brain. It becomes a male brain. And when I teach this in my workshops to my families, the females elbow their husbands, and I let them have their one moment of glory, and I say that that is our excuse. We have half the brain, as you guys do. Females are more complicated. In men, it's simply about serotonin. Halfway back the brain, in females, you must have an estradiol no lower than 60 to 80. Your lowest estradiol output, ladies, is in the premenstrual period. Therefore, you see a lot of serotonin deficiency symptoms in the premenstrual period. And beyond that, in a chapter I wrote for Suzanne Summers in 2012, I explained how these toxins, through the two mechanisms, fatty acid oxidation and mitochondrial shutdown, are shutting down the hypothalamus so it no longer can actuate and respond to a dropout of downstream hormones. The adrenal fatigue in 90% of people is not the adrenals. It's the switch. It's the brain. you must look at the ratio of brain hormone to downstream hormone, and you determine these things. So this is a disaster. Now, you may see different statistics. When I made this slide in 2010, 1 out of 88 children had the autism, and I think it's the 1 out of 38 now. Look, the gene pool has not changed that much in 30 years. But by 1980, we had made it, most of the homes and buildings in the Western Europe, Canada, America, airtight, energy efficient. So the molds that are hidden behind the wall, under the windowsill, etc., above the ceiling tile, those molds, the gases produced by those molds, they're not diluted with fresh air. And our brains in America have become so entrained just to leave the doors closed, leave the windows closed, and breathe indoor air. If you are of Northern European genetics, which most people in this room are, you will have the mold toxin genetics. It is not 24% of Americans. It is 99% of my clinic. The darker the skin, the less prevalence of the gene that you do not effectively remove these mycotoxins. So once you breathe them in, I said years ago in 2009, they will circulate the bloodstream for a short time before they will migrate to and deposit in the fattiest organ, the brain, because they're lipophilic, fatty molecular structure. I was mocked by many neurologists, as you would expect. Many of you have been mocked. Daniel's been mocked by psychiatrists years ago. Look, what I said about mycotoxins being the #1 cause of the surge of MS was proven by Japanese neuroscientists in rat brains. 2 years later, in 2011, we give our patients that study. So, furthermore, the trichothecene gas, there's 180, 200 scientists disagree, trichothecenes. Having measured 6,015 by February of 2015 and correlated those to over 300 and some biomarkers, you see the effect, whether scientists prove it first or later. Trichothecene is 10 times more liver toxic than alcohol, which means it shuts down the cytochrome P450 enzymes. There's 7 of them, right? Phase 1 detox. Once trichothecene shuts down your cytochrome P450 enzymes, you do not remove these other toxins that are bombarding us. So God gave us this. It's where I want to live. And we made this. You know, I'm not going to dwell on these. You can read this anywhere. I'm going to go to deeper science. I'm assuming you've already seen some of these statistics with Dr. Shaw, et cetera. One of my Chinese patients gave me this. Isn't that beautiful? Hamilton, Ontario, we have a census normally of 25% Canadians. And I've taken more people out of wheelchairs in Canada per capita than any other country. A majority of these young ladies you're going to see on this slide, we've taken 30-some patients out of wheelchairs in the last few years. Half the wheelchair people go public. All these folks have a video testimonial. My YouTube channel is dr.Rick Sponaugle, and come to my booth and you can see some of these. But, you know, Kamea was 10 when she went into a wheelchair. Now she drug her left leg. A Sponaugleism, what I teach my staff is, look, unilateral is most likely infection. It was just a thought from having spent years in the intensive care unit, surgical arena, that infection will hit a certain spot. You have a blood-borne infection. Why does it hit one heart valve and not all 4? My theory was, and patients have proven through our PET brain imaging, that toxins will hit the brain in a bilateral fashion. They'll shut down both the left and right caudate nucleus, one of the 3 motor regions that, when underactive, causes OCD. And that's hot off the press neuroscience. And I realize now some of the patients I treated years ago, and I would raise the serotonin in the Asperger's kids, the Pandas kids who had developed antibodies to serotonin receptors. I had to raise the serotonin level to 1,800, not 600, to calm the anterior cingulate gyrus that cause the OCD traits, because they have beat up receptors and reduced receptivity, okay? But there's a certain limit by which you'll stop. And after the study came out, probably 2 years ago, maybe more, that the caudate nucleus, which resides within the basal ganglia, alongside of the substantia nigra, the quote Parkinson's region, and the lentiform nucleus, all three of these regions are turned on electrically by dopamine. But the caudate nucleus is actually a relay center, it turns out, that moves information from the midbrain to the forebrain, and when one side or the other is underactive, it can cause severe OCD that will not be treated effectively by raising serotonin activity, okay, and calming an anterior cingulate gyrus. Every one of these patients has a story. They've all been hit by black mold in their home or office, and once the trichothecene toxin shuts down the liver enzymes, they don't remove the industrial toxins. You'll notice so many Canadians. I treated 4 of these children. I'm supposed to treat Judah. 2 of these children had such bad MS at age 10 they couldn't feel their bowel movements. Well, they show up with 4. What are you going to do? I treated all 4 for free for a year. The family, the Sponaugle family, all the patients and family members paid for their hotel, for their food, because they burned down the house in British Columbia because it was so full of black mold, it wasn't worth fixing. I mean, what are you going to do, send them home? So the deal is, beyond Judah, the majority of these Canadians come from Hamilton. And, you know, we'll go back to this. I mean, Hamilton is a disaster. The cancer rate in Hamilton is 7 times that of the rest of Canada. Any Canadians here today? Okay. You know what I'm talking about? They call it the hammer. I will be speaking in Toronto on October 28th on Lyme and PET scan research that I presented at iLabs last year. If you go to my YouTube channel, you'll see mold toxicity and Lyme disease, or vice versa, double trouble for the brain. A webinar I performed in November of 16, and you'll see a multitude of PET scans, and you learn that trichothecene, unlike all the other toxins, will shut down the cerebellum first. The cerebellar Purkinje cells are more sensitive to toxin-induced downregulation of electrical activity than the frontal lobe. I said for years, as neuroscientists who understand neurotoxicity still do, the frontal lobe shuts down first. Most patients realize, or they ascertain, geez, brain fog comes first, 4-second memory shut down. And they don't realize they're less coordinated unless it's really bad. So, you know, the majority of these folks were dying from their home. Amy, who has a wonderful video testimonial, had not walked for 9 years when she was referred to me by the chair lady or chairman, whatever, University of Kansas, Jeannie Driscoll, a brilliant physician who runs the Integrative Medicine department. And she went to Katrina to do the Christian thing, she said, and help the victims of Katrina move into a dormitory. Unfortunately, the dormitory had been closed for 15 years, and there was mold growing all over the walls and ceiling. And what were they doing? Something you shouldn't do, and your family members in Houston and all over the world. Do not bleach the mold spores. It ruptures the spores. There's a surge of gases released. And I've had patients who develop Parkinsonian symptoms. The men get Parkinsonian symptoms, where women get MS and MS symptoms. I've got a theory, but I won't espouse it until I have more validation. So, but Jeannie went down to the, and she has a gorgeous video testimonial, came to me, had not walked for years. Her husband was a big guy, fortunately. He carried her back and forth. She was on all kinds of Parkinsonian medications. Her dopamine level was 3,000. The Cinemet will raise the dopamine level to 2,000, 3,000. Still doesn't work. It's not about the level, it's about the receptivity. Speaking of which, you must optimize testosterone as well as thyroid in both sexes for dopamine receptivity, all right? So these folks all had Lyme disease, yes. Mosquitoes are carrying Lyme. I said it in 2009. When I took over my daughter's care after 2 years with a very intelligent ILADS doctor, but the 5 to 6 antibiotics a day destroyed her. I had already done my own clinical research on SIBO, and had the proof of Klebsiella, Proteus, Interbacteriaceae. When they move into the small intestine, they have a tryptophanase enzyme that steals the tryptophan. And so you develop severe serotonin deficiency. I'd already written research on yeast overgrowth, candida overgrowth, causing taurine wasting in the kidneys. You get those chapters or copies of those chapters that went in various naturopathic books at my booth. So I argued with the doctor about my daughter who bit her fingernails back to the second knuckle. I said, Doc, it's the antibiotics you're giving her, and it's the gut dysbiosis. No, it's the Lyme. Having said that, Lyme spirochetes can still tryptophan. They make a toxin called conurinic acid, a neurotoxin. It's on the organic acid test. Truthfully, I measure over 450 to 500 mathematical biomarkers in every patient. My consultation is at least 3 hours. And then we add the PET scan afterwards, et cetera. So when you correlate all these numbers at one time, you see things and you do a process of elimination. And you learn what is really taking the patient down versus what they think. If you have a website that talks about trichothecene toxicity, it is becoming more popular, but that won't bring patients to your clinic. But Lyme disease is in vogue. I would suggest that most of you, unless you stayed inside all the time, were injected with Lyme spirochetes by age 10. Wrap your brain around the fact that mosquitoes are carrying spirochetes. You want the proof? PubMed. I love PubMed. I'm addicted to it. Too much. University of Frankfurt. Go to PubMed, University of Frankfurt, mosquitoes, spirochetes, et cetera. So mosquitoes are carrying everything, and the blood smears we've done for years will prove it. And you don't kill it if you have no immune system. These patients all had Lyme disease. They had multiple infections because they had no immune system. HIV virus will shut down the production of CD4 T cells, correct? Well, so do petroleum chemicals, and so does trichothecene. German scientists proved in rats that trichothecene shuts down the production of white blood cells. That's all they proved. University of Marseille in France, the best research in the world, how trichothecenes destroy the intestinal transporters. So patients like Suzanne Summers' granddaughter, who I treated in 2012, who's eaten nothing but organic and gluten-free, would eat a piece of gluten-free bread that big, and her belly would blow up like she's 6 months pregnant. You've seen this in your patients. I would have told you in 2007 and 2005 that yeast mycotoxins are the main etiology, the primary etiology of destroying the intestinal lining. They are at best 10% as lethal to the intestinal lining as trichothecene. That is the silent killer, because again, the black molds don't smell. And you folks, the majority of you have Northern European genetics, very dominant gene, and so you do not effectively remove these gases. And so once they circulate, they move to the brain and more specifically to the myelin sheath, which most of you know is 80% fatty content. So the myelin sheath is under attack from all the lipophilic pesticides, mycotoxins, and industrial toxins. These Canadian girls all bathe in the bathwater out of Lake Ontario. What a disaster. It's the worst of the Great Lakes. So every one of these patients had black mold in their home except for Amy, who just, within 3 weeks of bleaching the mold in the dormitory in New Orleans, developed Parkinsonian Tremors, and in 8 weeks couldn't walk. Parkinsonian Tremors are one thing, but when you shut down the motor region completely, you can't move. The rigidity, like the nursing home patients who were placed on Haldol. Anybody remember those days? They walked like robots. Well, she couldn't move at all. And I said, well, if I can get you walking, it would take 2 years. Fortunately, she didn't have a lot of infection. And that differentiates whether you're in my clinic for 4 weeks and transformed, or you're there for 6 months or 9 months. It varies. It's all about the biofilm. We'll talk about that probably afterwards if you come to my booth. The deal is, Amy was jogging. You'll see it in her video. I think it was 12 or 14 weeks outside of my office. So we never know. But She came late. I prefer to get a Parkinsonian patient or an MS patient within a reasonable time of diagnosis. All these young kids, right down to Kamea, who at age 10 went from 4 hours a day of gymnastics to dragging her left leg in a wheelchair. I get her 4 years later at age 14, and we had to kill some Lyme. Her right motor strip on her PET scan was underactive. Lyme spirochetes love the motor strip. They love the cerebellum, et cetera. So different areas in the brain are infected by spirochetes, by Bartonella, et cetera. But the key is we should kill these infections upon injection. We don't. Our ancestors did. Trichothecene destroys TNF-alpha, the primary messenger of the immune system. Methotrexate destroys it. Trico destroys the Peyer's patch in the gut lining, so that these patients have no antibodies. I've correlated trichothecene levels with CD4, CD8 ratios. CD4 T cells say, let's go to war, let's fight. CD8 suppressors say, don't. When you remove the trichothecene from the patient's bloodstream and it's no longer marinating the bone marrow, you can see the CD4, CD8 ratio come up and the patient will start killing on their own, like they should. So HIV is not good, but trichothecene is worse for immune suppression, depending on your exposure, et cetera. So in my clinic, the immune systems are suppressed more than HIV patients. And these patients are all an example. Then there's the industrial toxins, and this was a disaster. April of 10, by June of 11, I began to see the MS in females and the Parkinsonian symptoms in males. I'm gonna move faster. What a disaster it was. Dennis came to me with a CD4 count of 50. Now, CD4 T cells should be 500 to 1,500. That's a bell-shaped curve. He was 50. Ochsner Clinic tested him 5 times for HIV. But the doctors there are traditional, like we were trained. They had no clue that he had a methylethylbenzene level of 42,000. Folks, notice that 7,000 places you in the worst 5% of people tested in Western Europe, Canada, America. So he was 6 graphs off the graph. Dennis referred at least 50 patients. Several females had laid in bed for 2 or 3 years with MS. One woman had 21 MRIs evaluating MS. It's amazing. Styrene. Notice that benzene is the grandfather. Scientists just figured out about 2 years ago that they have missed the target. Benzene comes out of the ground like the gas leak in LA. It immediately converts to methylethylbenzene. Methylbenzene. Notice that xylene is dimethylbenzene. Dennis had no benzene. It didn't show up on the test. Why? Around the gas wells, we measure benzene levels and tell the workers they're safe. Wrong. The benzene levels are 1 part per billion. The Fed said in LA, up in the hills, they had the gas leak that went on from October of 15 to March of 16. 1 part per billion in the air. If you're more than 2 miles away, you're safe. Catherine Bell had come earlier, brought a friend of hers for Lyme disease a year earlier and learned about these things and called me and said, hey, my kids are in a school that's 4 miles from the gas leak and all the teachers are passing out. They've all got nausea, et cetera, et cetera. Symptoms of benzene toxicity. And, you know, we did this test and it was just stratospheric. And I have to back off the feds and back off of the governors of Louisiana, et cetera. Look, the deal is scientists did not realize benzene hits the air, grabs a carbon, 3 hydrogens, it's methylbenzene. Ethylbenzene. Notice xylene is dimethylbenzene. You'll notice when you do this testing, you won't see benzene very rarely. Dennis came to me, a VP of Vice President of Marketing of VP. His video, you'll see he couldn't lift a spoon. A genius guy. He couldn't grab words. Fatigue, depression, anxiety, and for treatment, this is after actually, In 3 weeks, he's jogging because he didn't go into a spontaneous kill. I repeated his PET scan on a third Friday. He's now slalom skiing, by the way. You can watch his video. The mitochondrial dysfunction, you've already seen this. You've already heard from the other speakers about the triglycylglycine marker. He was actually a 9.5. One of my tech people made a mistake coming in. At the time, 1.9 placed you in the worst 5% of patients tested. When you get the mitochondrial dysfunction down to nothing, the mitochondria actually work, then the brain wakes up. The brain cells, our brain cells, and that includes the retina, which is part of the brain, not the eye, have the most mitochondria per cell. Most of you know this, and I don't want to be redundant, okay? November 18 and December 4th. Because his T cell count was so low, I knew he wouldn't start busting biofilm, which is toxin-laden. It was my theory in 2012, and one of the doctors I spoke with today said, geez, I'm making people healthier. Why do they suddenly go backwards on the tox test? Because when the bugs spin the biofilm, they're sequestering toxins. How did I prove that when scientists had not? I measured mycotoxin levels and industrial toxin levels right before and right after I intentionally busted biofilm with intravenous vitamin C. On my website, if you go to the biofilm page, you'll see Carol from Jersey, who had massive Bartonella biofilm with Ehrlichia, Lyme, et cetera, within the biofilm. And she had been treated for 6 years with IV Rocephin. All you do is make the microorganisms inside more resistant to the antibiotics because you get bacteriostatic levels, not bactericidal, and you make them more agitated, and they spin more biofilm. So Dennis, I was hoping he would not move into a spontaneous kill because his CD4 T cell count was so low. So we repeated the PET scan on Friday. All we did the first 3 weeks was detox the bloodstream, and we have a protocol designed that is a phospholipid protocol that includes alpha-lipoic acid and phosphatidylcholine, et cetera, and you mobilize toxins from the fattiest tissue, whether it's cell membranes. Every cell membrane in your body is 50% phosphatidylcholine, but ALA is the master antioxidant. And when ALA moves into mitochondria, the bad guys move out. Dennis's mitochondrial dysfunction was, a majority of it was the actual petrotoxicity. We did not attempt to kill the Lyme spirochetes that were hitting this is the inferior view. On these scans, black is good, blue is underactive if you use colors, yellow is more underactive, and Dennis had, look at the cerebellum, the left cerebellar tonsil. He had 97% increased brain activity after 3 weeks of treatment. The right, 87 is it? I can't see from here. I guess I can't see that yet. Anyway, the deal is the right didn't improve as much as the left. Notice the caudate nucleus. I was wrong on the initial PET scan review. The caudate was shut down initially 1.47, 1.486, whatever. Bilateral equal shutdown, and a Sponaugle-ism is around my clinic. Toxins will shut down these regions on both sides equally. So I told Dennis and his wife, the petrotoxins have shut down your caudate equally. I was wrong. I've had patients with severe OCD. When I move the toxins out of the caudate, the OCD goes away. Dennis didn't have resting tremors. Some do, some don't. But on repeat scan, remember, we didn't attempt to kill any infection. Notice the caudate nucleus. Where is it? Right there we go. See the left caudate electrical activity or glucose metabolism came up 89%. Why did the right come up, what is it, 50? I can't even see this. Usually you can see, is it 40-something? It was a 50% improvement. Why is that? Because the right caudate nucleus was infected. Now, Dennis, like so many of my patients, had brucellosis. He had Lyme disease, he had Bartonella, he had it all, okay? And all those things are terrible. In fact, in my clinic, the majority of patients with severe neurological tremors, with the exception of paralysis, which is underactivity in the motor strip, and that's normally Lyme spirochetes, but a majority of the patients, when it comes to the caudate nucleus, the infection is coming from Bartonella. At any rate, we won't go too deep into that. What about the brain chemistry? Certain petrotoxins will shut down monoamine oxidase B, which metabolizes dopamine to DOPAC. Now you learned from Dr. Wooler's talk, the cresol from Clostridia downregulates dopamine beta hydroxylase. Well, cresol is also a metabolite of toluene, and your patients who are exposed to a lot of petrochemicals, their father's a painter, leaves the paint cans in the mudroom, and the VOCs are imbibed by the 19-year-old daughter who has a seizure disorder. The etiology is a shutdown of the glutamic acid decarboxylase enzyme, okay? You can shut down the mayo as well with cresol. Ochratoxin, the gas produced by aspergillus and penicillin molds, the musty-smelling molds, also downregulates mayo B activity, okay? So you can see a shift where patients do not convert dopamine normally. I'm going to skip some of these deeper things because I have a lot of things to teach you. Because of the mayo B versus mayo A, monoamine, mayo A converts serotonin to non-active 5-HIAA. But B, the first cousin enzyme, converts to dopamine. The majority of my patients will have an imbalance between dopamine and norepinephrine. We should continuously convert the dopamine to norepi, and what we see in toxic people is that the dopamine may be normal or even elevated, and yet the norepinephrine is 50% and even 10% of what it should be. One note, this is the cyanuric acid. It's a neurotoxin. It's produced by multiple things, but remember, the SIBO guys, and we have chapters you can read that I've written for other folks. Again, SIBO bacteria will convert tryptophan to kynurenic. This one is actually calming. Lyme spirochetes will convert tryptophan to quinolinic acid, which actually activates the NMDA receptor like glutamate. So, but the caveat is you need the GPL tox test because styrene at high levels prevents conversion of quinolinic acid downstream. I think quinolinic acid is a better Lyme marker than the CD57 lymphocyte. That's my personal opinion. But you have to use multiple tests and have multiple numbers at the same time, the same hour of the day to ascertain what's doing what. Again, Dennis glutamate GABA shift. A normal glutamate would be 20, but it varies based on your ability to absorb glutamine, which becomes glutamate. A 20 glutamate, let me rephrase this, the electrical current from a 20 glutamate on the testing we do is neutralized, if you will, by a GABA of 6. So you see a shift in glutamate GABA in Dennis. It's mild compared to other patients I'll show you. Our record glutamate is 110,000. That's a 19-year-old kid from Houston. If you have friends in Houston, tell them to get the hell out of there before the flood because the refinery smoke is killing them. In most cities, it's the bathwater. The petrochemicals have saturated most of the rivers. They're dumping, they don't tell us. There are very few cities that are safe. I can tell you which ones are and which ones are not. So the black mold issues, whether it's under the windowsill, behind the shower tile, behind the basement walls, normally hidden. Most of you will not look at black mold and not do something about it, but you are unaware of the hidden black mold. That is everywhere. Even in Scottsdale, patients will have problems with black mold behind the shower tile. But the more humid the weather, the more probability of having an issue. Mayo A, of course, a plus, you guys know. it means you convert serotonin to 5-HIAA 4 times more readily than other people. So you genetically will have a lower serotonin level. The last thing you need is for trichothecene to shut down your intestinal transporters, and so you can absorb no tryptophan. In addition to that, if you have Klebsiella, Proteus, or Enterobacteriaceae stealing tryptophan, you'll notice the tryptophan is even lower. So I'm going to get to some better slides. Channing couldn't drive a car when she came. Her father, who's a software engineer for NASA, various people, he said, look, every home we ever lived in had black mold, visible black mold. She had all these issues. That was her after treatment. I'm going to move more quickly. Testing with LabCorp Quest will give you some of these guys. Quest will give you Cresol for toluene. Again, it's on your oat test. So Cresol can come from Clostridia, but it's also a metabolite of toluene. LabCorp will give you phenol for benzene and hippuric acid for toluene. So these chemicals convert in multiple directions. Channing had a hippuric acid that was sky high. My record is 4,400. And again, it's apples and oranges, whether it's Petro or Trico. So you can't say one's stronger than the other, but in my opinion, the petrochemicals are much more potent in downregulating the enzyme activity of glutamic acid decarboxylase. And this is causing the majority of bipolar. So after measuring neurotransmitters from July of 06 to July of 07, by that time I realized, having treated many bipolar patients who were using OxyContin to block the calcium channel and downregulate the voltage, I realized, geez, we've been blocking the wrong brain chemical. And when you do that, you cause a suicidality, you shut down the reward center. It is a black hole that patients describe is much more, there's much more suicidality with that black hole than there is the melancholic depression derived from an overactive deep limbic system, which is a serotonin taurine deal. We'll discuss this. I want to show you dopamine hydroxylase is shut down. You see that serotonin is relatively normal. Norepinephrine should be 40 on this testing. You see the glutamate GABA shift. Notice over here, Channing, when she popped toxins out of biofilm and hippuric acid hit the outrageous level of 2,900, she developed seizures, global seizures, tachycardia. I'd already diagnosed a Wolff-Parkinson-White syndrome, short PR on the EKG. It's being missed. Watch for it. If you're going to treat neurotoxic patients, you need to have the ability to treat cardiac arrhythmias. So when the glutamate surges to 11,000, is that ridiculous? The previous company we did the neuroscience testing with, they had a ceiling level at 180 for glutamate. They raised it to 250 and then greater than 350 for my patients. The ones who came in and said, I can kill a cell phone in 3 weeks with my EMF. You don't believe these people at first. But when I convinced Doctors Data to do this test 3 years ago, they go all the way. And 11,000 is ridiculous. And that is what happens when you get massive release of toxins from biofilm. And problematic with tick-borne patients is once you make them healthy with intravenous nutrition, because they can't absorb anything, their gut lining is destroyed, like Violet Summers. She'd eaten nothing but organic and gluten-free. Why did she get the 6-month pregnancy look? How many of you have seen that in your practice or experienced it personally? The gut lining is so thinned out, and it's just intense, what we call capillary leak in the ICU. Some of you have been taught to call it third spacing. And when the inflammation of the gut lining is so severe, they just blow up. And this is where the majority of the food allergies are coming from. Again, I would have told you in 2007, the Candida mycotoxins are the main etiology, the primary etiology of destroying the gut lining, along with bacterial endotoxins. And I will tell you, they're just not nearly as potent as Trico and some of the other toxins. We see in this case, dopamine levels are like a 180, a 200 for good cognition, 4-second memory, motor regions, etc., and of all things, the reward center. And you notice that we have a normal, it's all about percentile, relativity, folks. And reasonably normal dopamine, but the norepi is in the basement. It should be 40. So that is a downregulation of dopamine hydroxylase. So what you have with the glutamate GABA shift, now this is extreme, but you're wired from the glutamate GABA shift, but tired from lack of norepi and epi. The epinephrine should be 10. The norepi should be 40. And my patients come in with a norepinephrine of 10 or 8, and one of the kids you saw in a wheelchair picture from England, her epinephrine on the neurotransmitter testing was 0.8. Can you imagine? Now that's what I would have focused on 7, 8 years ago without focusing on mitochondria. But the same toxins that are downregulating the conversion of dopamine to noradrenaline. Noradrenaline, by the way, is made, at least 90% of it, we think. We always think we don't know what we don't know, what we had wrong until we learned something new. 90% is made in the A5 nucleus in the brain. So a sick, toxic A5 nucleus will not make the norepinephrine. 90% of pure adrenaline or epinephrine is supposedly made in the adrenals. But when you have norepi in the basement and epinephrine in the basement, severe chronic fatigue, and yet fibromyalgia. Have you ever seen a fibromyalgia patient who didn't also have chronic fatigue? Anyone ever seen that? They're over-electrified, but it's different enzymes. Lack of conversion downstream. Now, the noradrenaline converts to pure adrenaline, epinephrine. The number one cofactor that will prevent that is the lack of SAMe. Now, methionine, one of your essential amino acids, and my patients are down to bottom 2 percentile, even though they've eaten better than 98% of the country. Methionine, if you add a methyl group, it becomes SAMe. And you can give these patients SAMe. I like to do it intravenously as much as we can. And methylation genetics is an issue. And if you have a double 677, you supposedly methylate 70% less effectively than the best methylators. But I want you to think. We have all these patients who are double 677. If that was their big issue, why were they an all-state soccer player? Why did this woman do the work of 3 women, raise 3 children, lecture all over the country? I've got all these stories. And these folks were fine until they moved into a bad home, moved from one bank office to the next, or had a flood in their basement, et cetera, et cetera. And what you learn when you correlate trichothecene levels, as I have in thousands of people, with all these numbers, is that trichothecene is shutting down methylation enzymes more than the SNPs. You're told you can't give more than 2,000 milligrams of glutathione. It can convert backwards to homocysteine. But when you measure all these numbers at one time, you realize that methionine synthase that converts homocysteine, the bad guy, to the good guy, is shut down. So when you remove the toxins, you actually convert the homocysteine to methionine. If you do know, how many of you do amino acid testing? Majority of you. Have you noticed your methionine is lower than a lot of the other essential amino acids in severely toxic patients? Pay attention, you'll notice that, because it's used up. Because methionine is at the very top of the pathway to get to glutathione. And I usually show that pathway in my workshop. So this is an extreme example, but the majority of people in America have excessive electrical voltage. Glutamate is the very first step in the electrical pathway. Glutamate activates NMDA, which opens the calcium channel. Now, yes, you can have overactive calcium channels. I've measured those things for years with Genemind. I don't even bother anymore. It doesn't matter because the genetics, that patient with the same toxin levels and the same glutamate GABA shift will have, yes, more electrical current in their brain and body. But in the end, they didn't have a problem. They did not have a problem until they got a glutamate GABA shift. Are you with me? Epigenetics versus genetics. If you have overactive sodium channels, you will be more electrified than other people with the same level of toxicity. Okay? So it's just about asking questions, spending time with patients, and I've had thousands of patients, of which you can look at their video testimonials, and they have all this genetic stuff. And the focus is on it. It's easy and it's sexy to focus on SNPs. But when you talk to patients, you have to wonder why they become so successful. And I say women because my practice is 82% female. It has been for years. That's because men just are in denial, right, ladies? If a wife doesn't force a man to go for help, well, I don't need help. And let me say this. Judgment and impulse control are medial frontal lobe. And it's amazing. The more toxic a patient gets, the less judgment they have, the more difficulty you're going to convince them, especially if they're a man, and they might have to spend some money to find the black mold to remediate. It's the more toxic, the less judgment, the more difficult they are to work with. This is Channing's, one of her PET scans. Notice the black is good, blue is not. Blue is underactive if you want to use colors. Her father, again, talked about black mold everywhere. She had nausea every day from age 2. They call the vomitoxin. When trichotoxins is used in biological warfare, the victims bleed out in 3 hours and die from bleeding out the gut lining, but it hits the pancreas. Nausea, think pancreas. And all the young females go to the ER, they're having a panic attack, and they're having nausea. And I have a Harvard-trained ER doctor working with me right now. And I said, Josh, how many young females, if you put a bag on their face, if you're a female, forget it. If you're a young female, forget it. You're emotional, you have a panic attack, it's derived from a shift in brain chemistry. At the same time, the trichotoxin moving around the bloodstream is pickling the pancreas. I've said this for years. A study just came out proving the pancreatitis and worse, pancreatic cancer. And we were seeing when we mobilize Trico with phospholipid therapy, we can actually get a patient's pancreatic enzymes up to normal. This young lady was nauseated from age 2, and then you got to move it forward, become more sensitive with your questioning. If they weren't nauseated every day, were they just more prone to motion sickness? And when you detoxify patients like Channing, and thousands I've treated, you actually see they have low pancreatic enzymes. None of us were taught to look for low enzymes, were we? Because they've had a chronic subclinical. Subclinical means what? Simply not diagnosed. Subclinical pancreatitis for years. They've had nausea every morning. We kill more at night. They bust biofilm more at night. They wake up with nausea. So look for these patterns. These people have had pancreatitis, and if their enzymes are measured versus putting a bag on their face and saying you're hyperventilating, yeah, they're hyperventilating because they're having a panic attack. But the etiology is the same. Work from the mechanism, and you see the common denominators. And on her deal, just for her cerebellum, which was shut down the most, and again, this research at Sponaugle Wellness has proven that the cerebellar Purkinje cells are much more sensitive than the frontal lobe brain cells to trichotoxin, but not the petrotoxins. So, is that a signal? I'm done? Okay. So notice the 225% increased brain activity as measured by the computer. You can't make these things up, guys. The computer calculates the difference in the metabolism. Now, why did the right side not come up as the right side was affected? Let's go back and look at this. Notice inferior view, okay? And over here we're mostly black. There's multiple things I could talk about. We won't have time because we're supposed to focus on brain chemistry. But this girl also wore sunglasses for 6 years. And it can be just excitoneurotoxicity that makes the patient more photosensitive. The same patient, if it is because of elevated electrical current, will also have tinnitus. In my own strange brain, I figured out in 2006 what's causing tinnitus. We have hair fibers in the middle ear, don't we? They send an electrical impulse up here to the 8th cranial nerve. If the electrical current in the brain is excessive, the impulse will be amplified. So you start with buzzing to ringing And in one case I had with an oxalic acid at 700, 800 and went to 3800 with a biofilm bust. 10-year-old kid, please go to this video. Taylor Neighbors, her mother, did an hour-and-a-half Oprah story. In 1 year, in a house where the spores were heavy inside the room, she developed tinnitus that went from buzzing to screeching. She became schizophrenic, and she moved from 20/20 intervision to 2350. Oxalic acid, the data says it causes premature cataracts. That's the lens, not the retina. The fatty lipophilic toxins are destroying the retina. I had 2 retinal attachments in 2009 after 3 years in a hospital office with a saturated black mold wall. I knew Trico was causing it. It's been proven in 2011 by German scientists. So the vision issues you see are from the fatty toxins, but the lens, oxalic acid, which goes sky high if you're actually imbibing the spores, and it's a metabolite of spore breakdown. Yes, it comes from Clostridia. But the oxalic acid is changing the vision of kids all over America. How many of you have had a son or daughter who after 1 or 2 years in elementary school became nearsighted? Can you raise your hands? Okay. Everybody's shy, hand with the ear. Think about it. You have to extrapolate. The schools are mold incubators. They cut off the air in the summer. They go back into school. You're shaking your head. Isn't it fascinating? It's fascinating. So think about it. Why do these kids suddenly become nearsighted? Because they're breathing spores in, they're metabolizing them, breaking them down, and the oxalic acid goes sky high, and the oxalates deposit in the lens. Taylor Neighbors came to me 2350 in 3 weeks. We had her back to 2020. We didn't know we could do it. It doesn't work as well in older people, but she only had the problem for 1 year. Emory Pediatric Ophthalmology, along with 11 private practice ophthalmologists, said, take Taylor home and love her. She's legally blind, nothing we can do. Emory Pediatric Psychiatry said, put her in a home for schizophrenic kids. You watch her video, Taylor Neighbors. She was throwing chairs at her mother, saying, I want a real mother. I didn't use that. I had permission to. You will see her stomping and kicking. Her mother talked for an hour and a half. I interjected, maybe too much, trying to teach other mothers what the hell is going on with your kids. In their case, it was a home. It's often schools. But the common denominator in her case was the oxalic acid that came in. She comes in at 700. When she starts popping biofilm formations, because we give her good stuff, a doctor asked me today, geez, I'm giving people good stuff and they're going backwards on her GPL tox test. I said, yes, I was clueless until 2012, and I did the intentional pop on Carol on the biofilm page. And the problematic, these toxins are sequestered in biofilm, and that is Pandora's box, and you better be ready to treat aggressively in tick-borne patients who have a lot of biofilm, and depending where they live, if they come from Hamilton or Niagara, Canada, where the cancer prevalence is 7 times the rest of Canada, it's the bath water, it's Lake Ontario water. The petrochemicals are coming in through your skin. You need charcoal filtration on the entire home, folks. Not on your drinking water. You get you imbibe way more petrotoxins from the water, from bathing and showering than you do drinking. They're lipophilic. They go right through the fatty skin cell membranes. And that's always a surprise to the very intelligent women who come to me. They've read everything they can read, and I'm always amazed with their health IQ. But they always think, geez, my drinking water, I've got it filtered, I'm good to go. Not with lipophilic toxins. Bath, shower. Channing also had pupils that were dilated 95%. Look at your patient's pupils. Pupils are dilated from a Chiari malformation, which is very common in mold toxic patients, because trichothecene, one study in the world, you find at 2 in the morning, from China, destroys the chondroblasts that repair the cartilage and the ligaments. So 25-year-old girls who don't use their head, the REM as a fullback, et cetera, have disc suppression, but they also develop Chiari syndrome with increased intracranial pressure. The other mechanism by which patients have light sensitivity and dilated pupils is infection in the brain camera, the visual area in the medial occipital lobe. And we have on a webinar I did in November 16. It was the IMMH presentation I did and way more. Toward the end of this 5-hour webinar, you can just flip forward, you'll see Denise from Louisiana, who was 22,000. Had seen 11 ophthalmologists, including the Oster Clinic. If the retina is fine and the lens is fine, we don't know why you can't see. Well, where does the retina send the electronic message? To the brain camera. And the patterns, and they're just associations, but Bartonella is the key in most people to the infection. That underactivity there in the visual area will cause tremendous light sensitivity, dilated pupils. So there's a little pearl for you. We're going to move on. Just Julia, Trico Toxicity, circa 1920, University of Miami High School. Julia came to us in a wheelchair last summer. I like to do this mathematical thing in my mind on the initial consultation. Is your problem 80% infection or is it 80% toxicity, 50-50, whatever? Julia was lucky. If you send me a patient or you come as a patient, I've had several doctors I've met that are coming as patients. Where's that other lady, that dermatologist anyway? She said she's shy. Here's the deal. 4-second memory loss, of course. The 4-second processing learning memory is in the dorsolateral prefrontal cortex. Right here, guys. This is where it starts. How many of you have a relative with Alzheimer's? Well, okay. How many of them were prescribed Aricept, which blocks the conversion of acetylcholine, which is the neurotransmitter that runs the 4-day memory? They got no better. How many of them got better on those drugs that raise acetylcholine levels? Thank you. None. Because it starts here, guys. I said this for years. I backed off on picking on American neurology. It's no better in Europe. We have lots of Europeans and lots of Australians. Look, you process, you imbibe everything I'm saying right here. This 4-second processing memory runs on dopamine. Not only does trichothecene destroy the dopamine factories in this region and the Parkinsonian region, the substantia nigra, et cetera, it blocks the dopamine from the receptor. And that's Sponaugle Wellness research. We'll get to it. This woman comes in. She was a school teacher in this high school. She's in a wheelchair for 3 years. Depression, of course. Where do you see her neurotransmitters? Panic disorder. Now, this is a picture of her in 4 weeks, but what we don't have is her video. So on my YouTube channel, go to Julia. And you'll see her jogging in the back of my office at 4 weeks. She's a lucky one. She was not infected. She was more of the inside girl, playing piano, writing poetry. Like my oldest daughter, who's in New York, came to me toxed out 2 years ago, broke some records on the GPL tox test, August of 15, transformed back to normal and phenomenal in 2 weeks, versus my daughter, Alexa, you'll see on my website, who played with every animal. My God, we had a zoo. Horses and goats and everything and dogs, and my God, it's just, don't let your kids sleep with dogs. Don't let them kiss dogs. That's where the neuro cysticercosis comes from. New studies, worms in the brain. At least 2% of Americans, and every study, recent study says underdiagnosed, undiagnosed, and neglected. Those are the titles. This is where microbiologists, 5 minutes, okay, let's hit Julia fast. We got to move. There's a lot to teach you guys. Julia had severe depression. Depression is derived from a lot of things, but 2 specific brain regions. Daniel Amen first figured out that deep limbic system overactivity would cause depression. He says it's a serotonin issue. It turns out that those nerves are GABAergic. It turns out that serotonin and taurine calm by enhancing GABA receptivity. Taurine is more important for calming the brain than serotonin. Taurine has a subunit on the GABA-A receptor. So, underactive nucleus accumbens, driven by dopamine, and we'll skip these things. We got no time. Nucleus accumbens. Now, look at this. We'll probably have to end it. Okay, so Julia is wired but tired. So let's look at this. She's my record low serotonin out of 11,000. 14.7 serotonin. Research I performed again using SPECT scans. I would send patients to Daniel. I looked at the neurotransmitters. Again, Most of you folks would need at least a 600 serotonin level, and you females need an estradiol of 60 to 80 pGs per ml for optimal serotonin receptivity. Men, we're lucky. We don't have as much complications. 14.4 causes a severe overactive deep limbic, a severe overactive anterior cingulate gyrus. You'd think she'd be miserable, but her faith, you cannot separate the spiritual from the organic biochemical. She could have been what I call the pooch face, especially having been in a wheelchair for 3 years, but she wasn't. Serotonin, 14.7. Her taurine wasn't so bad, relatively. I like a 2,000 to calm the deep limbic system. But she was taking a lot of taurine and supplements. Her dopamine was 50. So her reward center was doing nothing. So her depression was from both places. So she has depression, and yet she's wired. Why is she wired? It turns out that trichothecene and ochratoxin suppress tyrosine hydroxylase that converts tyrosine to L-DOPA, the rate-limiting step. Then the tyrosine, which can become thyroid, or PEA, converts to PEA. PEA should be 50, and she was almost double. And her glutamate GABA shift, she should be 20 to 6. She's 80 to 3. Do the math. So she's very wired, yet extremely tired because she's got no norepi. Norepi is 7 versus 40, and pure adrenaline is, 3.5. And this was her on the other side. You can see how within a week or 3 weeks, I think, at the same time she pops out of the wheelchair. We're pumping and dumping, as I call it, toxins from the myelin sheath. When the myelin sheath is inflamed with these fatty toxins, research at Florida State University Biomedical Engineering Department has proven that the EMF around the axon changes and the voltage slows down, and you get a paralysis in the worst cases. The D2 receptor, which runs the reward center, the underactive D2 activity can be inherited through the DRD2 gene. The research came out in 1999 by Ken Thompson. I've been talking about it since 2000. You can have that from a low dopamine level or from the genetics or Trico blockade. Eating, University of Virginia study, raises D2 activity 3 times normal for 90 minutes, orgasm 10 times normal, and cocaine 100-fold normal, and nicotine is much stronger than those drugs. Inability to get excited if you inherit 10% less or 20% less D2 receptors, not frank depression. Seasonal affective disorder. I wrote about this in 2010 in a depression chapter, which you get a copy of. Trichothecene will block the D2 receptor. Well, how did I figure out that? By watching patients who have massive tricho levels, and you pull out the tricho from the bloodstream, it subsequently is removed from the synapse, and they'll come out of a deep, dark, suicidal black hole in 10 minutes. It's amazing. Now, to put the icing on the cake, German neuroscientists proved that Trico blocks the T3 thyroid from the receptor on the mitochondria. Now, tyrosine becomes L-DOPA or PEA, or it becomes thyroid by adding 4 iodines. Can we all agree that the T3 thyroid molecule has mimicry we call it in medicine? It has the same molecular structure pretty much as dopamine. So a toxin that will block dopamine from a receptor or thyroid from a receptor, is it likely it can also block dopamine? Think on a biochemistry, biomolecular level, and you can correlate these things. This is research from before. I want to talk about this. We'll skip this. There's so much to talk about. I want to show you one more thing. I got 1 minute. It's just, you can't teach what I do and teach and want to teach you. Again, I do this for every patient. The tyrosine becomes T4. Look, the car is tyrosine. Giving patients iodine, that's the mirrors on the car. It won't do anything for thyroid production. But the bigger problem, as I taught Suzanne Summers in 2011, over the phone, which was somewhat difficult without the slides, is that it's not the thyroid. It's not the adrenals. That's why the adrenal food you're prescribing your patients and you're taking never helped you. It's the ACTH hormone suppression. You have to look at the brain hormone and the downstream hormone. We were not taught to do that. You young people in the audience, look at the ratio. It's all about relativity. Our time is up.